Hi, if you've just joined us, welcome. We'll be starting in a few minutes. So we'll go ahead and stay muted and cameras off. We'll be starting in just a minute.
Thank you.
Yeah. Hi, if you're just joining us, thanks for joining. We'll be starting here in just a minute. We're going to ask that people stay muted. We'll have time for question and answers at the end, but we'll get going in just a minute here. All right, Paula, would you like to get going? It's 2 o'clock.
Sure. Thank you, Suzanne. My name is Paula Yensen, and I serve on the county board representing the 5th District, and I want to welcome everybody for being here today to have a discussion about senior services in McHenry County, the COVID-19 town hall. I've been on the county board since 2008, and I serve on the board of directors of AgeGuide, and I chair the Senior Services Grant Commission, along with being the liaison to the Mental Health Board. I am so delighted that you're here today to have a discussion about this very important issue in our county. Thank you. Suzanne.
Thank you, Paula. So I'm doing a little bit of multitasking here as I admit people in, and also want to welcome and join Paula and welcoming all of you to our town hall. When we first talked about doing this, I was really excited because I know that with the numbers, and I know so many of you have seen it, people in long-term care facilities, seniors are part of that vulnerable population, and the pandemic has hit that age group particularly hard. So when we were talking about it, I was delighted to be able to be a part of this, and thought about what we wanted to do and how we wanted to share information with the community. So I am on the county board as well. I've been there not quite 2 years. I represent District 2, but I've had the pleasure and the opportunity to get to learn so much about McHenry County, the services that we have here, and also, quite frankly, where we can even make improvements. So I'm happy you're all here today. I'm also acting as the technician for the call. So with that, I've got a couple Zoom tips to keep in mind with everybody. So I have it set so that you're all muted as you came into the call, but you can unmute yourselves, and we're good with that because we want people to be able to ask questions at the end. However, if you do find yourself unmuted, if you just run your cursor along the bottom of your screen, you can, you'll see controls, or you can even click on put your cursor over your name and see unmute or mute. So you can, please keep yourself muted unless you're speaking. It helps with feedback. Also, I hope you're comfortable and you're ready to sit in and hear some great information, things that are less distracting, especially if you have your camera on. That will help us as well. When we get to the question and answers, we're going to do it 2 ways. The first is, if you want to do it by voice, you are more than welcome to unmute yourself. We're just going to ask you to state your name and your business and or town where you live, and then ask your question. And then the second way you can ask a question is there's a chat feature. So right now, I'm not sure what it looks like in your end, but when I stop sharing my screen, which I will in a minute, you'll be able to scroll along the bottom. There's a little, looks like a little comment bubble, and you can just click on that and send a chat or a text, and that will send a question in as well. So finally, if you have any technical issues, if you get cut out, you can't get back into the meeting, that's my cell phone at the bottom, 815-608-0252. Give me a call or send me a text. I am on call to help with those needs, help you out if I can. So with that, Paula is going to introduce us to our first speaker, and I will turn the mic over.
Thank you. I'm delighted to introduce Lesley Hedstrom. She is the Director of Planning, Grants, and Program Development for AgeGuide. And it's one of the 13 area agencies on aging throughout Illinois. She leads AgeGuide's advocacy, coordination, program development, and grants administrative activities, and she also directs the area plan and strategic planning, and to ensure that all funded Older American Act service delivery systems meet the needs of older adults and their caregivers who reside within the 8-county planning and service area. And I happen to work with her, and I hold her in very high esteem for what she has been doing as far as servicing seniors in our county. Lesley, are you here?
Mute. I guess I had to unmute myself. I thought that was being done. I'm so sorry. Thank you for that lovely introduction. It's such a pleasure working with you, having you on the board of directors, and also being able to work with you in McHenry County where I live. So thank you again. As Paula mentioned, AgeGuide has an 8-county service area, which includes Lake, McHenry, Kane, DuPage, Kendall, Will, Grundy, and Kankakee counties. We have over 700,000 persons, 60 and over, in our region. In McHenry County, we are fortunate to have many community partners, and we provide state and federal funding to Catholic Charities, Archdiocese of Chicago, Independence Health and Therapy, Prairie State Legal, and Senior Services Associates. These funded service providers offer services to over 12,000 older adults, their families, and loved ones in McHenry County each year. At AgeGuide, our mission is to empower older adults to remain independent, connected, and to age well. We do this through our advocacy and coordination of life-saving resources such as meals, transportation, caregiver, and family support. These meaningful services optimize the quality of life, and they also offer peace of mind. While we all know that older adults are safer at home right now due to COVID-19, more time at home can present its own challenges, such as social isolation, less access to nutritious meals, and it offers a lot of caregiver stress. AgeGuide recognizes that connecting resources to these homebound older adults is essential, and can make connecting an enormous difference in their safety and their quality of life. During the current pandemic and stay-at-home orders, community and based services have become a lifeline for many older adults. These supports are critical to helping older adults remain safe, healthy, and independent, avoiding unnecessary or premature placement in long-term facilities. And there was funding offered by the federal and state government. One sort of funding was the Families First COVID-19 Relief Act, and the other was the CARES Act, which provided funding to area agencies on aging to expand older American services throughout our region, and we worked with our funded partners to do this. During this COVID pandemic, AgeGuide has also offered guidance to our funded providers on how to safely deliver services, and we offered funding, as I mentioned, to expand services. In addition to weekly calls with our nutrition service providers, bi-monthly calls with our funded providers, COVID resource emails for older adults that we prepared for our funded service providers, for them to take and actually modify them so that it was a way for them to, basically they were constant contact pieces that we created that they could then in turn take and adapt and send out to their older adult clients and participants, because we knew they were going to be so busy modifying and changing their programs to meet the new restrictions and the new sheltering in place orders that we were cognizant of the fact that they may not have time to develop all of these resources. So we put them out into the community so that our community partners and our funded partners could use these resources and get the information out to older adults. We also offered and put together from those resources, we created a resource guide, which I have given a link to in our chat. So then I would encourage everyone to go to the AgeGuide website, which is www.ageguide.org, for the COVID-19 resource guide that we created. That is basically what we sent out and have been sending out every week on Thursdays to our funded providers throughout our region. In addition to all of that, we've expanded our legislative outreach to connect with legislators and their constituents about resources, services, and the needs of older adults at this time. At this time, I would like to highlight some of the Older American Act expanded and adapted programs being offered, how we are advocating for COVID protections in long-term facilities, and special projects that have been taking place to reduce social isolation, and especially those being implemented in McHenry County, as well as sharing, like I mentioned, the resource guide, which is on the chat. I'm going to start with the expansion of nutrition services. As I mentioned, Catholic Charities Archdiocese of Chicago is the nutrition service provider in McHenry County. In mid-March, Illinois Department on Aging offered immediate guidance that congregate meal sites or community dining sites, which are usually held in senior centers, needed to modify their service delivery design to protect clients from exposure to COVID-19. Now, when we say modify, they were basically strongly encouraged to close that as an option where everybody would meet together in large groups because they were concerned about spreading COVID-19. Catholic Charities, similar to all of the funded providers and Aging Network service providers, really had to make changes and modify quickly. So Catholic Charities in the COVID environment today is currently offering 2 nutritious meal options. The first is a carry-out meal program, which targets older adults who can come to pick up their meals. Basically, there are traditional congregate meal, or as the public would probably see this as a community dining experience. So those people that would go into the township buildings and go into senior centers and get a meal in addition to having socialization programming. These programs operate usually a few times per week at a convenient location in our counties, and this is being done throughout the entire region, but we're focusing on McHenry County. We know we've had some great success with these carry-out meal programs, and we know in large part that's due to our nutrition service providers working on partnerships with townships, local restaurants, and other community organizations. So one of these carry-out places is 31 North Cafe, which is located in McHenry, and it has carry-out service on Tuesday, Thursday, and Friday. And each participant who drives through to pick up the meals are actually prepared at 31 North. They get 2 hot meals when they drive through. So the idea being that they can have one today, and then if they want, they can put one in the refrigerator and heat it up for the next day. In addition to 31 North, we also have another pickup location or carryout location at the Crystal Lake Holiday Inn. and that offers carryout service on Tuesdays and Thursdays. And then another carryout place is Georgia's Restaurant in Algonquin, and it is offering carryout on Friday. And all of those locations, when a client or a participant would drive through, they'll get 2 hot meals in each of those locations on the days I mentioned. Now, one of the questions you may have is if I know an older adult who's interested in this carryout service, how do they go about it? Do I just tell them to go to 31 North? And the answer to that is they need to contact Catholic Charities. And the reason for that is everybody who is interested and is in a carryout meal can certainly get one, but we have to have reservations so they know how many meals to prepare for when people drive through to pick up their carryout. So please, if you know somebody who's interested in a meal, have them give Catholic Charities a call. On average, a total of about 75 meals are picked up from each of these sites during the days that I said that they were opened. In addition, the traditional congregate sites are all now carry-out meal sites, with the exception of Marengo Park District. The Park District in Marengo just closed. So for those clients who were used to going there for community dining, they're having their meals delivered to them at their homes. Door Township, so some of these locations would include Door Township, Walden Oaks, and McHenry Senior Center. And like I said, they're all doing curbside pickup of meals, and they're serving up to 150 clients on any given day. And that would be the traditional situations. And the second nutrition service option is the one that everybody is very familiar with, and that's the home delivered meal program. Due to sheltering in place, that sheltering in place order, IDOI guided nutrition service providers to consider all older adults age 60 and older homebound, because they were told they should not leave their home because they were more susceptible to get this virus. So because of that, the doors really swung open, and anyone who was concerned about going to a grocery store or had any concerns at all or anxieties about contracting COVID could qualify during this temporary time until we are told otherwise for a home delivered meal. So usually anybody who wants a meal, an older American Act service, can get services. And it's based on need, not on income. So I want to let everybody know that right now, because I know a lot of times we think that things are based on income. And in the case of older American services, such as nutrition services, it is really just based on need. But for home delivered meal program services, you have to be unable to leave your home to go shopping. You have to be maybe unable to drive, unable to walk, maybe not ambulatory. So that's a specific situation where the need is great, because you cannot, it would be you'd like one step away from maybe being in a nursing home or a long-term care facility. So people deliver home delivered meals 5 days a week to these persons. So when somebody's interested in a home delivered meal, what happens is somebody from Senior Services Associates goes out and does a comprehensive care assessment. And if they meet all the guidelines and they're truly unable to go out from their home to get meals, then they qualify for home delivered meals on a normal basis. But like I said, due to COVID, that has been waived temporarily, and anybody who's interested in a home delivered meal can get one. So I just want to make sure that's understood. And it is not forever. In fact, these people that are getting meals currently that weren't on the rolls before are being told that this is a special circumstance. And when this waiver is over, when IDOA lets us know when this is done, they will be doing assessments. It's not that they were automatically stopped services, but then Senior Services Associate staff will have to go out and do assessments to make sure they're qualified for this. So then the next question is, what happens if they're not qualified for home delivered meals anymore? So then at that point, we would tell these individuals that they are more than welcome to join their counterparts at the community dining sites that are throughout the county. So hopefully I've explained that well enough, and we can move on to another area that I wanted to speak with you about, which is the statewide initiative to reduce social isolation. Now in 2019, there was a bit of luck in that the General Assembly provided funding, general revenue funding, to reduce social isolation. Nobody had any idea that COVID was coming, but they did know that there's serious issues, mental health and physical issues that can arise due to social isolation. So they provided funding for all of the area agencies to expand, well, to start new programming or expand programming that would decrease or reduce social isolation. So we were all in the state very fortunate to have been thinking and preparing and running pilot programs in advance to reduce social isolation, which became even more prevalent once COVID hit. So in McHenry County, we had a couple of programs already in place. We know many of you are familiar that Senior Services Associates has what they call a senior companion program, but also known in IDOA as a friendly visiting program. So they already had that program in place and has been running successfully for many years. But we also asked them to do a telephone reassurance program. And we wanted that program to assist with, we were trying to reduce, for a while there was a waiting list in McHenry County for home delivered meals. It wasn't, there was a combination of issues, whether it was some income related or financially feasible to deliver meals. There was a shortage of funds at some points, but then there wasn't a shortage of funds. It became more of a capacity issue where we didn't have enough people to deliver meals in McHenry County to all of the persons that needed them. So they wound up waiting on a waiting list till capacity was available to deliver a meal. So we introduced Mom's Meals, which is a for-profit organization that now, in order to meet the demands of this increased need for food, are now delivering meals, drop shipping meals to people who need home delivered meals. And Senior Services Associates has been contracting with AgeGuide until September 30th to make telephone reassurance calls to these clients getting these meals. Think about them like well-being checks. So that's being done, and the end of our fiscal year for that program is September 30th. After September 30th, Catholic Charities will continue to work with Mom's Meals to provide meals where there's a capacity need. Because right now we have the funding, but we might not always have the volunteers in place or the drivers in place to drive the meals. So this partnership has worked out well because the meals can be brought there, and then we can follow up with phone calls to make sure everything is going smoothly with the program. So that will continue till September 30th, and then Senior Services Associates is going to have the funding to expand their friendly visiting program, or as they call it, Senior Companion Program, throughout the county. We wanted to provide them with more income to do that because we've never funded at the Illinois Department on Aging level, we've never funded that program. And we saw the success of this program and we wanted to continue to help them continue the great work that they're doing, especially in light of the COVID-19 situation. We are hearing more and more about older adults who are fearful to leave their home and are also feeling very, very isolated. So that's one program that we're working on. And another one we're really excited about is the Education and Technology Program. That is a partnership between Area Agency on Aging and T-Mobile. We've, at the agency level, we paid for 2 years of data. And for those 2 years of data for 60 clients in FY20, in fiscal 20, and we're also going to do it in 21, we're getting an additional 60 tablets for 60 more persons throughout the region. But anyway, so they are not only getting these tablets for free, they have to have 3 classes on how to use, that's where the education comes in, on how to use these tablets. We did not want them to be paperweights on their bedside. We wanted them to be able to learn how to use them. Now we know our older adults are getting a little more familiar with Zoom because they're connecting with their family now and grandkids because they have no choice. They want to see them, so they're learning how to use the technology. And AgeGuide has worked very closely with people in the community to put together a curriculum to help people, to guide our older adults through accessing different applications and learning how to write on their tablet, and learning how to write emails, and how to get into Facebook, and all these type of educational components. And we're offering it to our senior centers, like at Senior Services Associates. They have two in McHenry County, one in McHenry and the other in Crystal Lake. So they'll be getting those curriculums. And through the CARES Act, our funded providers are also buying technology to share with their older adults that live in the county. And we're hoping that they'll be able to use the curriculum that was created to help educate their older adults as they offer them technology on how to really use it effectively and get the most out of it. So that's another one we're really excited about. And finally, we're doing some more targeted outreach in the community, with the real goal being to access limited English-speaking people in our communities. We know that they are vulnerable and more isolated than most because they just they have the barrier of language getting in the way of them receiving the services that they need. So we have a partnership with CLEASE, which is the Coalition of Limited English-Speaking Seniors, and they have translation services available, and we're working closely with them to have them help translate funding documents so that they can be aware of services that are available and funding opportunities that may help them basically access services that are available for everyone, but the language is a barrier for them receiving these services. So I also wanted to tell you a little bit about another. Oh,
hey, Lesley.
am I
sorry.
over?
Yeah.
Wow. I am so sorry.
That's okay. It's just
long.
very informative. So
much to share.
Yes,
that's okay. There's more about caregivers we could talk about later. If there's any questions on caregiver supports, I've got some good programs for that. I apologize for running over.
No, you're okay. You're okay. It was good information. Thank you. We're going to go ahead and welcome Tom Annarella to speak next. And I have the pleasure of introducing him. And for those of you that don't know, Tom Annarella is the director of the Valley High Nursing Home, which is the county run and maintained nursing home here in McHenry County. And Tom has done an outstanding job in managing through this time of COVID, so much to the point that there have been 0 cases of COVID-19 among residents or staff. But I'll let Tom tell you how he got to those numbers. Otherwise, Tom, you're on. Thank you.
Thank you. I appreciate it. I don't even know where to start with all of this. So when I asked our 2 moderators what they wanted me to cover, they basically just said, well, just tell what you did. And I thought about that for a second, and I started making notes as we were going along here. But I think more or less trying to get people to understand what has happened to the congregate living communities. So we're talking about long-term care facilities, nursing homes, assisted living, skilled peds, developmentally disabled, like all of your congregate living settings. People want to know what happened, why are we on lockdown, and how are we going to reopen again? And so I thought I would just kind of cover the broad scope of that, and then if there's time, we could talk a little bit about kind of what we did in the pre-planning phases. So probably the most important thing is to help people understand who sets the rules for congregate living and who then will allow us to reopen. And it's not an easy answer. You have the CDC that provides guidelines, and you have CMS, which is your Center for Medicare and Medicaid Services, that dictates the policy piece. So the CDC gives you a guideline, then the CMS makes it into a regulation of some sort, sends it down to the Illinois Department of Public Health, who then enforces that guideline. So we locked facilities down from a congregate living standpoint early March, and unfortunately, a lot of our residents have not even had the opportunity to see their loved ones in about 3 months now, which is becoming a real significant problem. I will tell you, I fielded a couple very upset family phone calls, even today, about, well, when can we see, mom and dad? It's been 3 months. The governor has made it pretty clear that long-term care facilities are not part of the reopening plan. If you look at the Restore Illinois plan, there is no reference to congregate living. And that has to do with quite a few different factors. The main ones being, we are the most vulnerable population, and we want to protect all of our seniors as best as possible. But the other piece is being able to get baseline testing done. And what that means is the testing of all of the staff and all of the residents to make sure that everybody is in fact negative and the building is clear. And then there's a CDC recommendation that you wait 28 days from the date of your last positive test. Now, Valley High has been lucky enough, blessed, I'll even say, to not have any cases in the building. So our 28-day clock has not started, but we still would not be able to reopen the building until the governor allows that process. We've had plans in place now for a while to reopen the building as early as July 5th, the week of July 5th or 6th, whichever that Monday is, to have families come in. And we've even thought about doing outdoor visits. I'll just put this out there that there is no rhyme or reason as to what type of outdoor venues are acceptable and are not acceptable. So for example, you can go to a restaurant and eat your meal with a group of people in a small setting, socially distanced. You cannot come to a nursing home and visit your loved one on the back patio with masks on, being socially distanced from other families. So it's kind of creating a little bit of a problem for the families. One of the questions we get a lot is what helps a long-term care or a congregate living facility be successful in a situation like COVID-19. The biggest thing is being prepared, and being prepared early on. One of the benefits that we had was identifying that there was going to be supply chain issues early on and ordering what we needed way before it even hit. And you'll see that a lot of the nursing homes that got hit really bad, there was a couple of key factors that happened well before COVID-19 that impacted their ability to respond to it. One of them being constant underfunding in the state of Illinois. The other one being numerous unfunded mandates on top of that underfunding. And then the third thing being that just the availability of resources to expend in that type of a scenario and to stockpile. The biggest recommendation I could give to anybody in a congregate living facility coming out of this is that now that PPE and isolation related supplies are becoming available on the marketplace, don't stop buying it. Buy it until you've got a 4-month supply on hand, because when we hit the fall, the all likelihood is we're going to do this all again. And so having ample supply on hand is what helps keep the staff safe and wanting to come to work, which then helps keep the residents safe and healthy, and it all kind of works in that symbiotic relationship. So what does reopening look like, and what does the timeline look like? Your best guess is my best guess. I would love to say that July would be the time when most long-term care facilities would get to that 28-day mark and have their baseline testing done. But until the governor says we're going to go ahead and reopen long-term care or provide some guidelines, and that's going to come through public health, we're still stuck being, pretty much locked down to anyone from the outside. Valley High is itself. We've been locked down since the first week of March. We just started letting doctors back in the building last week, vendors back in the building on the week of the 22nd, and hopefully families the week of July 6th if all goes as planned. So I will hold the rest of my stuff to get us back on time. But if you guys have questions at the end, feel free to shoot them out, and I'll be here till the end. Thanks.
Thank you, Tom. So Paula, would you like to introduce Micki? Oh.
You're muted.
Oh, you're muted, Paula. I can't find your name fast enough to unmute you, so. Oh, there you are, Paula. Paula, where'd you go? Oh, okay.
Suzanne,
There you are, Paula. I can hear you now.
I worked with Micki Miller when I was the executive director of United Way, when she was the executive director of Elder Day. And I don't know how many years ago that was, Micki, but I got to tell you, you're the best grant writer I've ever met. When I would get the grant over at United Way, it was a stellar grant application. And now we have her expertise that she brings to senior services associates. She has had a long history in working in senior programming, and we're so fortunate to have you at the helm, Micki. So please tell everyone the good work that you do.
Well, thank you, Paula. It's more years than I care to remember. I was at Elder Day for about 13 and a half, and I've already been at senior services for over 9 years. So I started as a child, and I've been working ever since. So thank you for that introduction. I really appreciate being asked to be a part of this group today. Lesley and I know each other very well. We work together on all the programs, so it's very nice to be a part of this group. I want to talk a little bit about how quickly things changed with COVID. You know, Lesley mentioned about the nutrition meals, and we have been a very big part of that. We normally do the assessments for the home delivered meals, and when COVID started to happen, we immediately started to reach out to all the clients we had, saying, how are you doing in terms of food production? Do you have supplies that you need at home? We had a multitude of staff and volunteers who reached out and wanted to help. And it's been really important for us to reach out to people who were at the Congregate sites to make sure that they knew that there were alternatives available. And we were providing the mom's meals and the telephone reassurance calls right away. So it's great to have so many partners in McHenry County to work with, other providers of other agencies. We're very good at calling each other and saying, hey, I have somebody who needs, and if we can't meet their need, then we reach out to the other partners in the community. But we had a party for St. Patrick's Day one day, and the next day we were all locked down. And that was very difficult for the seniors of McHenry County because we were all together as a group, and instantly that was gone. Had we known that this was going to happen, we'd have been a little better prepared in sharing with the seniors, this is going to happen, let's try to prepare. What are things that you can be doing to not feel so socially isolated? So it really came very quickly. And as Tom said, in the long-term care facilities, people immediately stopped being able to visit with their family members. Now, we don't run a long-term care facility, but we do have ombudsman services who are the resident advocates. And I can tell you that our ombudsmen are getting called constantly by family members who are not happy because they cannot see their loved ones. And it's understandable. This has been months and no one knew it was going to take this long. So of course we start to hear questions of, well, my rights are being infringed upon. You know, these are my inalienable rights. We should be able to do this. And it's a fine line for the ombudsman to talk about the CDC regulations and what we have put in place in the long-term care facilities for safety, because the ombudsman cardinal rule is to advocate for what their seniors want. And their seniors want to see their families. So again, another situation where we did not have time to prepare people to go into this. It's especially been difficult for people who have dementia because they can't hold on to the reasons that they're given in the first place as to why they can't have visits. You know, it's hard for them, for a caregiver of a family member who has dementia. Even when I say to them, I'll be back tomorrow, they don't know tomorrow. And when I do come tomorrow, they're like, why has it been so long since I've seen you? And I was just there the day before. So that time concept is difficult for them in the first place. And now it's gone very long. And they really feel abandoned, many of them. And for our seniors, we do have the 2 senior centers in McHenry at the Township Building and our new building in Crystal Lake on 3 Oaks Road. We do assessments for the folks out of those buildings, and all of our assessments have always been done face-to-face. When we meet and do public benefit applications with our seniors, it's always been done face-to-face. The Adult Protective Services staff go out to investigate to make sure there's not elder abuse. It's always been done face-to-face. So instantly, all of these things no longer could be done face-to-face. And while this has been stressful for the people we work with, it's also very stressful for the staff because they love to meet face-to-face with the clients. And they are chomping at the bit to get back out doing their face-to-face visits. That includes our volunteers. You know, we have a huge volunteer base with our retired senior volunteer program. We have the senior companions / friendly visitors. And we have transportation volunteers who drive our folks to different doctor's appointments. They all want to be seeing their people. And there have been numerous calls saying, well, if I wear my mask, why can't I do this? And in some situations, it has been allowed because the transportation, especially now that the doctor's appointments are being done again, we need to make sure that we have volunteers to transport. But we talk about the hand sanitizer, how they need to sit kitty corners from each other in the car. They both have to have their masks on. So it is starting to become active again. But the activities at the senior centers will be the last things that will be rolled out for us. I was just on a 3-hour call yesterday with the state, and we no sooner got done with that call talking about how our adult protective services people might go back out. And we got a lengthy email from the director of the Department on Aging saying, maybe this won't be as fast as what you think. We're going to form work groups in each category to look at this first because we have to come up with a plan and then it has to be approved by the governor. So it has been difficult because staff wants to get back out and they see some of the phase 3 and phase 4 guidelines coming out, but those do not relate to senior center activities. Those will not come during phase 3 and 4. Those are around phase 5. So it's going to be much longer than what you think. And so, as Lesley mentioned, we're working on Zoom classes for activities with the tablets and teaching the seniors how to use the tablets. I know that one person on this call happens to be one of our volunteers who teaches about computer programming to the seniors. So just a heads up, I'm sure you're going to be getting lots of calls to be volunteering to help instruct on this. And many of the seniors do have some sort of electronics that they can start with, but they do not have the comfortability yet. And I remember trying to teach my brother how to use his cell phone, and his fingers were too big, and he kept bumping the other buttons, and we'd go over it and over it and over it. And our ombudsman will be taking some of those into the long-term care facilities. So this is going to be across the board, something that all of our staff will be working on with our volunteers to get the seniors more comfortable with electronics. You know, we teach a lot of exercise, evidence-based exercise classes. In order to really evaluate that, we have to see them do the exercise. So it has to be a two-way call. So we can't just put it on Facebook and think that they're going to follow the rules of exercising. We need to watch them do that. There is a silver lining, I think, to all this. Social isolation has never been a popular topic for people. Funders don't want to fund it because they feel like programs that are done, bingo, the craft programs, the exercise programs, that's just fun and games. They've never seen it as something valuable. And these activities are more than fun and games. This is what keeps seniors' brains engaged. It's a muscle, you gotta exercise it. So it's not just fun and games. We really need to keep folks engaged. We need to work on improving their physical performance. We can increase their coordination. We can reduce their fall risks. We can improve their fine motor skills by some of the crafts that they do. So the loss of activities and the loss of the socialization that goes on is huge. And I think that it's going to have some very long-term effects on people. The upside of this is that everyone, not just seniors, now know what it feels like to be socially isolated. And most of us are going crazy being socially isolated. It's not good for anybody's mental health to be by themselves or to be stuck in a room looking at the computer all day. That's not helpful. We need that personal interconnection. We've been seeing quicker physical decline, quicker mental decline. We've seen the increased use of drugs and alcohol. Talk about wine Thursdays. You know, the parents who are trying to educate their children at home are taking that little wine break at the end of the day, and just the pure loneliness of it. And this is the way it's going to be for a while, I think. And as I said to the staff, while doing the Zoom calls and the Zoom classes is not ideal, it's better than nothing. You know, I've had a new grandbaby and I've only seen the baby over the Zoom call because we can't go there yet. And it's hard. But think about the Pilgrims. When they moved away, they never got to see their grandbaby. So I'm grateful for what I have, but it doesn't make up for that loss of physical touch. You know, our seniors call every day and say, when can I come home? It's so funny that they call the senior center home. When can I come home and see you guys? And they're lonely, they're tired of this. They want to see their friends, they want to see the staff. So I think the future, while this has been a really tremendous detriment to our society, I think we're going to see some long-term effects of this. As Lesley said, there's increased funding to combat social isolation. And I think that we will have additional funds for that going forward because people personally now know what the effects of that are. And we have provided reassurance phone calls to all of our clients all along, from our activity staff to our information and assistance workers. We are making hundreds of phone calls a week to reach out to them and say, how are you? Do you need materials? You know, are there things that we can shop for you for and take it to you? And I have to give kudos to my activity staff for the social centers because they prepared activity bags, or funtivity bags as they call it, where they've included toilet paper and paper towels, but they've also included puzzles, word searches. We've had some offices that included a plant from some of the botany kids at the high schools who created plants for them. We've given them small crafts to do to keep them occupied. And then some of the police departments and the sheriff's departments have gone and helped us and our volunteers deliver these activity bags to their front porches. And then we call them on the phone and say, we have a present for you on your front porch. And they go out and get the activity bags. And I've had so many thank you notes from people saying, could you please thank your staff and the sheriff's department for delivering my activity bag. So we are definitely trying to think outside the box, things that we haven't done before. But we need to go back after all of this and look at how effective were reassurance calls? How effective were these activity bags? was the loss of visits to the long-term care residents. Did it cause a faster decline in their health? Did it lead to a faster death? You know, and personally, I've had 2 people of mine who have been in long-term care pass away in the last month, one due to COVID, one not due to COVID. And we were seeing them on a weekly basis, and their life was sustainable. As soon as we stopped seeing them, they went downhill very quickly in 7 weeks of not being seen. Now, I'm not saying that that's why they died, but I think it added to the rate of decline for them. So I think when everything slows down, which is not yet, we're going to need to go back and look at that and see what kind of long-term effects stopping those visits had. And so all people, I think, will be much more responsive to the idea of social isolation and making sure that it doesn't happen again. And I think it will affect the funding in the future. And I just think that as agencies, we need to stay well connected with each other, because we cannot be all things to all people. And by working together, we can make up for those pockets that are missing. And it's always about the senior and their caregiving family members. You know, we need to keep them in the forefront, and how can we best meet their needs? And if it isn't our agency, then I'm going to reach out to somebody else. And earlier in the call, Suzanne had asked us about how many people we serve. Last year, senior services associates in our 3 counties served over 39,000 people. Wow. And just in McHenry County, last year, we served 16,182. So we do have the ability to touch many lives, because if you think of those seniors, most of them have at least one caregiving family member. So those numbers are twice that. And it's not just the senior, it's also their family members that we need to reach out to see how they're doing, because they're under a lot of stress staying home with their families. So thank you again for allowing me to talk. I know we have a time budget to sit on, so I don't want to be like Lesley and take too much time, you know.
Oh, well, thank you, everybody. And I was taking notes, and I should have mentioned at the start to everybody on the call, we are recording this. We got permission from the presenters ahead of time. So we'll make the recording available out to some various channels, and we'll provide an email afterward that you can also access it for. But now we'd like to go ahead and open up the floor to questions for our panelists. So if you would, remembering our agreements at the beginning, as you take turns and asking questions, just unmute yourself. Tell us who you are and whether you're from an organization or just which community you live in, and who your question is directed to. So who has a question? And don't be shy, by the way. You can also chat. Use the chat feature down below to type in a question, and Paula and I will do that. And actually, while you're thinking about some questions, I had a couple as we were talking. So my question, I have 2. I asked Tom to talk a little bit more about, similar to what Micki, what you talked about at the end there. If you were to talk about best practices, and I know that there's going to be so much learning and looking back and saying, what do we know now that we didn't know before that's going to happen? But just to Tom specifically, based on your experience thus far, if you had to name like 5 best practices or 4 best practices going forward for long-term care or congregate facilities, what would you say?
Well, let's see, 5 best. I wrote them down when you sent me it into the chat, and then I've had some side chats going on at the same time too, which I got to tell you, I've done a lot of Zoom meetings in the last few months. This is the first time that I've had an active side chat going on. So pretty cool.
All right. Well, that's good.
Props to you guys. So my 5 best practices, really, the first one is ongoing monitoring. We were watching what was happening and started preparing all the way back as early as January. We started watching what was going on when it was and I'll air quote this, an unusual cluster of pneumonia-like symptoms coming out of Wuhan, China. And that was the tip-off. You get about a month into that and you're watching it as it's growing. And it was a simple question, right? Where does most of your medical supplies come from? China. Who's going to get their supplies first? China. If China goes in lockdown and nobody works, what is going to be the first thing that you're going to experience? Supply chain problems. So staying that far ahead of it was the first key to all of it. The second piece was we were able to, because we were staying ahead of it, develop a response plan and test it before. And funny how things work, right? We developed the plan on Monday and tested it on Monday. By Wednesday, we had already locked down the building.
Wow.
And so we had a chance to do a tabletop to bring all the supervisors in and say, all right, let's put everything up on the board and break this plan over and over again until we feel pretty confident on it. And so we tested it on Monday, we trained the staff on Wednesday, we locked down on Thursday, and we were all in it. The second piece is open communication. Families, residents, staff, getting out in front of everybody and just saying, look, what you're seeing on the news is scary. What you're seeing on the news is real. And here's what we're going to do to make sure that everybody in this building is protected and safe. And that included some very difficult decisions with the staff. When we got on a Friday afternoon, the notification that the first case was identified in McHenry County, that moved us to the next phase of our plan. And we had to ask all of our staff who worked in other buildings to make that difficult choice of, you have to pick one. If we learned anything out of Kings County, Washington, which was the Seattle nursing home, it was the staff that were going between the buildings, whether it was hospice or nursing home staff, that was spreading the disease faster. So we got all of our staff to say, well, I'm going to go take a leave of absence and work for my primary, if they were a part-time employee with us, or we're going to take and work them. And the deal I made, I didn't, that's just a Valley High thing, but if they worked 40 hours here and 40 hours somewhere else, I'd work them 80 hours here and pay them the overtime just to ensure that they weren't working anywhere else. And so we did that with all of our partners. That was the hospice staff, therapy staff, anybody on the medical team. And that what you basically do at that point is you lock yourself into a very controlled group of people that you can monitor versus having a lot of one-offs that happen. So that was another one. And then we walked through this entire process from day one with a motto where we're saying, work the problem and adjust. I cannot tell you how many times we've revised the response plan. In the first 3 weeks, it was revised almost daily as new regulations, new guidelines, new thoughts were coming, down. At this point now, we've got a solid plan, but the plan has evolved into not just a response plan, but a day after plan, a testing plan, a reopening timeline, just a lot of pieces that go into making sure that everything that gets done is extremely measured. Now, one of the side conversations I was having was, it happens to be one of my family members for Valley High. And she was saying, be careful to reopen too quick. And she's spot on. And the key here is, as we're reopening, it's 14 days between the first group, 14 days the next group, 14 days. And so you can really slowly monitor and carefully monitor what is happening on the ground in real time. So those are probably the 5 best practices I could give you at this point. Staying ahead of it is number 1. And I think when asking my staff who work in other buildings, why did you choose to work here during the duration of this outbreak? The 3 things I got back were you had a plan, you have supplies, you're communicating. So I would say those are your top 3, and then the other 2 on the end, get ahead of it and stay ahead of it.
That's great. Thank you very much. Does anybody have a question?
I do.
Yeah.
Hi,
Cindy, hi.
hi. My name's Cindy Sullivan. I'm with Options and Advocacy. We have a number of children whose primary caregivers are their grandparents. And we're concerned these are primarily kids, young adults who have behaviors around the autism spectrum. Is there a flyer or a quick information sheet that we could send them, especially for the meal support? We support them any way we can. We had a little COVID grant, but we went through that like lightning. But we're really concerned with those grandparent caregivers.
Micki, who talked about food? You both did, Lesley and
We
Micki.
both did, yeah.
Yeah.
We actually do have a flyer that I'd be happy to send you to talk about nutritional needs. We do serve grandparents raising grandchildren through our programs. So I'd be happy to send you that. Will you be putting up our contact information, Suzanne?
Yes.
Okay.
Yeah, we have that at the end.
If you email me, I'd be happy to send you the flyer about that and also put you in touch with Catholic Charities, who's our nutrition provider.
Okay.
But that would be something we could do.
That'd be great. I have another question. Is there a process for which you can support each other within the county, the long-term care facilities or facilities like Sheltered Village? So you're kind of sharing your information and resources and processes to try to diminish the impact of COVID?
I'll field that one. And the answer is yes. The plan that we developed here at Valley High was put on the McHenry County Department of Health's website and shared with all long-term care facilities from the onset. And not that I want to go down the laundry list of things that I'm doing over the last couple months, but I'm also part of the task force to help reopen the congregate living piece for McHenry County. And I've been participating very actively in the emergency management process. So information that we are bringing in or we're gaining, we're pushing it out as fast as we possibly can so that we can all be successful.
Okay, that's awesome. Does that include group home providers for persons with developmental disabilities?
The plan that we developed is pretty broad. So anybody can, I would say what I did here is not going to work in other buildings as far as every single detail, but it's got the perfect framework for someone to be able to go and say, all right, this doesn't work for me, but here's how we adapt. So it's still available under the COVID-19 tab on the McHenry County Department of Health website.
Okay,
And I think it's still called Tom's Plan.
Okay. Thank you. It's been very helpful.
Great. We have a question in chat from Shannon. This is for those who are coordinating friendly phone calls. Is anyone doing quick assessments for depression, PHQ-2, for example, as folks are being contacted?
Lesley, do you want to talk about the questionnaire with friendly visiting?
Oh,
So I think, are you talking about the loneliness scale?
Yeah. Mm-hmm.
Okay. So for our friendly visiting program and for other telephone reassurance programs and stuff that we're providing throughout our region, we're having the persons that are involved in this to complete the UCLA 3-question loneliness scale, a pre and post test. So we can determine they'll start with that, and then 6 to 9 months later, or at the end of the duration of the program, they're taking it again, so we can see the success of the program and how it's helping people that are participating. So that is what we're doing from a special project point of view.
And I've gone over with my staff some of the depression questions, and as soon as some of our staff are well trained in depression, but I would not say that that's a strong suit for our activity staff. So when they are reaching out to their people, if they receive certain responses to some of the questions, then they are immediately referred to one of our care coordinators who's more comfortable handling those depression questions.
great.
I have a question.
Yeah.
For Tom, several of my constituents have called about testing. Contact tracing and testing in long-term care facility, having enough test kits And my understanding that the Illinois Department of Public Health is responsible. And Lesley, anybody chime in on my question. Do we have enough test kits, and is there a coordination of testing and contact tracing?
All right. So the testing question, that one has multiple answers too. There's three lanes to get a test done. There's you have an outbreak and the local health department's coordinating the test lane, which is then processed through the state lab or Quest. Then there's the other lane, which is the facility can contact the Illinois Department of Public Health, who will send a team out to do the testing, and it's processed through Quest. Or the third lane, which is the lane that Valley High started this morning, which is baseline testing using your lab. So why would you choose each one of the different avenues? Well, the first one's obvious. If you don't have an outbreak, you're not going to go down the outbreak road. But the second, and you could get it done through the state, and you're at the mercy of the state process, the state timeline, the state lab, the state everything. Or you can do it through your lab, in which case the Valley High team is the ones conducting the testing, and then the lab picks up the samples and then sends them off to Quest. But you can control that. You control the date, the time, the administration, and more importantly, and this is the key, you control who's doing the testing. We've had surveyors arrive in this building that were in COVID positive buildings the day before. If you want to keep this stuff out of your building, those are the types of scenarios you got to avoid at all costs. So we've elected to do the testing. If you would have asked me 3 weeks ago, I would have told you there's not enough tests to go around and it's physically impossible to pull this off. Now that we've reached this point where there's enough available tests, you can get it done relatively quickly. It is going to be required to reopen. You're going to have baseline testing done of all your residents and staff. Now the contact tracing piece, I'm not real confident that that system is up, running, and ready to go as well as it should be at this point. It actually was one of the side conversations that I was having was about testing and contact tracing. And I'll just leave the last comment that I said to them with you guys, which is this is Illinois, so all bets are off. But as of right now, it needs a lot of work.
Okay. And follow up with that, Lesley, is the AgeGuide and the local area agency on aging coalitions throughout the state working with creating different inspection accountabilities of long-term care facilities with the state, with IDPH?
Yes, they are. There are people from AgeGuide that are sitting on, there's all these different work groups throughout the state. And so their agency on aging and also members of our funded provider ombudsman, and they're all on these committees to see what's going to happen in the future. At AgeGuide, we are advocating for obviously the access to testing and adequate PPE in all the facilities and infectious disease control, and to expand access to technology to keep residents connected to their family and friends. So those are the big areas where we're advocating for long-term care, as well as sitting on these work groups with other funded providers to see what's happening going forward, or to advocate for positive results.
Thank you. Thank you.
Are there other questions? We have time for a couple more. So I shared the guide that Lesley referenced. She had put it in the chat at the beginning of the meeting before we actually had started. So just in case it wasn't available, I put the link in there again. But as I mentioned, this is recorded, so you'll be able to access that. And I do have, if you give me a minute here to pull up, I'm going to share my screen again. So Tom did share with me before the meeting. This is just, hold on a second. This is an epidemiologist chart of cases, and it shows our curve here in Illinois, and then it shows McHenry County. So I am very comforted to be in a state that did not open too soon, that has taken this in a very thoughtful manner, and we're looking at that downward turn. So I hope it stays that way. I think a number of you referenced already, we'll probably be doing this again in the winter, the fall and winter. But hopefully we've learned a lot from this process and this time that we've been going through it. So this will also be available online. And so this is everybody's contact information that was on the call. Just for a quick little hack, like if you wanted to do this fast, you could pull out your cell phones and take a picture of the screen. It will be available in the recording, which doesn't take too long to download. And once it's done, I'll send it out to everybody that we shared through the channels that we advertise this in. But you can reach out to any one of us, email any one of us, and we'll make sure you get a copy of it. So Lesley, I apologize. I did not have your email in there. I took it from your email, so that was my mistake, and I'll fix that at the end. So Paula, would you like to say a few words in closing? This has been a lot of fun. I just want to say that. Thank you for doing this with me.
I thought it was a lot of fun, and I learned a whole lot from everyone.
Yes.
And I feel very fortunate that we had such a stellar group of people to come and really have a substantive discussion about seniors in our county. And you know, the senior population is the fastest growing demographics in McHenry County. And the services that are being provided in McHenry County are a broad array. And if people are not aware of it, but we have a Senior Services Grant Commission within the county. It's a levy, and we allocate $1.65 million to senior programming to complement the money that is allocated to these senior programs in a variety of other ways, and to keep these programs in the hands of our clients, of the people that live here. I'm very proud to live here because of the kind of services that we have. We have a mental health board. We have the beautiful Valley High long-term care facilities. We have the Senior Services Grant Commission, and we have the Community Development Block Grant. We have a broad continuum of money allocations that really enhance the lives of seniors in our county. Would you like to add to that, Suzanne? I mean, I think we're very lucky to have this here.
Yeah, yes, I would agree with you. And if there's one thing I love from my time on the board, it's been getting to know people in the community, seeing what the needs are, and actually being able to say, here's a number to call, here's a place to go, and being able to actually connect people to services that they need. And I will doubly add that there is need out there, and just making those connections I think is so important. I have friends that they don't know what to do with their aging parents or caregivers who live far away, and you know, people want to stay in their homes for as long as they can. So I just think it's wonderful that we have all these options, and I'm glad that I know about them now. So I concur with Paula, and I want to thank Tom and Lesley and Micki for agreeing to do this with us. You were wonderful, and the information was timely and relevant and useful. So thank you all for doing this with us, and for everybody for joining. We had at one point 30 people logged in and chimed in to listen. So I was thrilled with that. So thank you so much, everybody, for coming out today. So
Thank you.
thank you. Have a great afternoon. Stay safe. We'll send this out as soon as the recording is done. Thanks again.
Bye-bye.
Bye-bye. Bye.
See you, everybody.
Bye. Thank you for hosting.
Oh my gosh.
Thank you, Micki.
Micki, it was great. Thank you.
Tom, you're wonderful. Fabulous. Thank you, Suzanne. You did a great job.
Oh my goodness, it was fun. You were great too.
I think people got something